Hi, welcome back to Vaguely Adults. You got one of your hosts, Sarana here, and
Shirley.
and today we're diving into a real light topic, one that we love so much. We're gonna be talking about healthcare. So, what's your experiences with healthcare in this country? This country being the United States of America.
Yes.
Exactly.
Very different now than when I was little. So I grew up, thankfully, under the poverty line, so I qualified for Medicaid.
Thankfully.
I mean,
Okay, yeah, circumstances.
for some things, yeah. So I qualified for Medicaid. So I had Medicaid most of my life growing up until I started working right after college. Once I got an income, even though it was like minimum wage,
Yeah.
I suddenly made too much money and they took my entire family off of Medicaid.
Which is really not a good system whatsoever.
Oh, not at all. And I'm not 100% sure how insurance works.
Oh, same.
Because like I have coworkers and friends who are still under their parents' insurance because you're supposed to be under your parents' insurance till you're like 26 or 24.
26.
Okay,
Yeah.
but at 20, I was already on my own insurance because doing like a family plan came out too expensive for my family. So I had to take out my own insurance and pay for my own insurance. And now I get insurance through work, which is a whole other beast because if I lose my job, I lose my insurance.
Which is, for the record, we don't think is the best means to have a human life tied to a job, because that puts you in a position where you can't leave your job even if you're unhappy or even if you're like going through a really rough time, because if you leave said job, you leave your insurance and you leave the livelihood that covers any sort of medical expense for you and like your partner or whatever.
And it's a trap. The only reason I was able to get insurance through work was when I became full-time employee.
Yeah.
When I was part-time, I didn't qualify because their requirements were you needed to be a full-time employee with the company to qualify for the insurance that they cover.
Yeah.
So they take money out of my paycheck. It's an insane amount of money out of my paycheck every 2 weeks to cover my insurance. The deductible is still kind of high, and I didn't know how deductibles worked until
I
like
still
2 months
don't
ago.
really understand them.
You are responsible for paying up to the deductible price. So if you get a surgery done that costs $20,000 and your deductible is $10,000, you are responsible for the first $10,000.
So what's the point of me paying for insurance?
They will cover the other $10,000.
That is still $10,000 though.
Yeah. So that was my thing when I had to get a bunch of tests done for the issues that I was going through. I had like a $1,500 deductible, and now I am $1,500 in debt with the hospital. But I still need to continue getting tests done because the doctors ran 1 million tests, did everything in the books, had a follow-up appointment 5 months after the tests were done. And he went, "So I fixed you?" And I said, No, I'm still having the same issues. And he went, Oh no.
We both had some very peculiar health issues in the last year, and some which, as always, when you go to a doctor, they're like, oh, it could be caused by stress, which is it's so stupid because everything that goes wrong could be tied back to stress, but it's like, I can't not be stressed. Like, I don't know. You can't just be like, oh, you're not depressed anymore. Oh, you're not anxious anymore. Oh, you're not stressed anymore. Boom, fixed you. It's not how that works.
But also you telling me that my health issues is caused by stress is stressing me out.
Yeah, so it's like, what am I supposed to do with this information? I'm just going to like dwell in it even more.
Yeah.
And then end up in your practice a bunch more times because you still have not fixed my initial issue, which is very interesting because when we were younger, I'm pretty sure we both had the mindset of like, oh, once we get to the age of adulthood, whether that be like between 23 to 26, which is kind of the bracket that we're falling into right now, we just like wake up one day and know everything that an adult knows.
Dude, I'm gonna tell you, this was my life plan. When I was a kid, I was like, I'm gonna graduate high school at 17 because I have a late birthday.
You don't have a late birthday.
It's the 8th month of the year. I mean, you have a later birthday, but compared to the people,
11th month in the year.
But compared to the people I went to school with, I had a late birthday because everybody was celebrating their birthdays and doing their little classroom parties in like May and June and April, and I had a summer birthday, so I graduated at 17 from high school and then turned 18. So I was like, all right, I'm gonna graduate high school at 17.
I started college at 17, so it's fine.
11th month, whatever. And then I was like, I'm going to go into college. It'll be 4 years. I'll graduate at 21.
I also graduated at 21 from university.
Whatever. I deferred a semester. I was like, I'm going to graduate at 21. And in this time that I was in school, I was like, I'm going to have perfect grades. I will have had an internship. I will have found the love of my life. At 22, I would be in my own apartment with a spouse and probably pregnant with a child and a career. By 23, I would just be set. I would just be working and have my child and have my partner and just work until it was time to retire.
Yeah, no, I mean, I have a similar, except everything's different. When I was in high school, I was definitely around like 15, 16. I was like, oh my God, by the time I'm 18, I'm going to move out and, I'll be in college by then. I'll probably be away for college. So, I'll have more freedom and I'll have a car and I'll be doing this and that. And then I graduated high school at 17 and had the harsh realization that one, I wasn't going away for university. Yeah. Two, I was going to have to live with my parents for the foreseeable future because higher education's expensive.
Yeah.
When I started off, I was under a program where my tuition was covered because I had good grades and blah, blah, blah. And then I transferred schools and then that wasn't the situation anymore. So I quickly realized that I had no idea what was going on. And it was also kind of when I started taking care of my health, like by myself, making my own appointments and doing all that stuff. And that also led to a very harsh realization of, oh, I don't know what's going on. You don't know what's going on. You're the doctor here. You're supposed to know exactly what's wrong and diagnose me so I can just go to the pharmacy and pick up some magical pills to like be cured. And then it just clicked. I was like, oh no. No,
nobody knows what's happening. I mean, if you think about it, right? You make friends who study all kinds of things and your friends, the stupid things they do, the stupid things they say sometimes, the idiot moves,
the weird choices that they decide to follow through on.
Very questionable tastes. And they're like the finance director for some big company.
Yeah.
Or like the CFO for another huge financial company, or a teacher teaching kindergartners.
Or someone in medical practices taking blood and doing like tests and samples and stuff like that. And you're just like, hold on.
Yeah.
These peers that I went to school with and saw doing a variety of questionable acts is now in charge of my health?
Yeah. It's scary. And it makes you think, like, if these are the people taking care of those people, then the people taking care of me could be better, or worse. Not to say your personal life plays into, like, how you are professionally, because at work, I'm very different from how I am.
Are you?
No, I'm the same. My voice just goes higher.
Oh, yeah.
Hi, welcome in.
You get your customer service voice.
Yeah.
I feel like everyone has that one. I had a meeting voice. Like, yes, hello, everyone. Welcome to today's meeting. Thank you for coming in. We really appreciate your time.
Blah, so it's blah, your podcast voice.
Oh.
Yeah.
Oh, I'm sorry, guys.
Her meeting voice is also her podcast voice.
To be fair, I was a lot more bubbly back in the day.
Interesting.
Like I was working in advertising. Like, fair. I was dressing like a director and working at a very low wage job, doing like 3 tiers above me in terms of workload and whatever.
Mood.
It was not it. Anyway, good thing I left that.
But yes, insurance.
Yes, still don't know.
I pay too much money. You pay money in case you get sick.
But then you get sick.
If you get sick,
you still
have
pay
to
money.
Yes. Because then there's co-pays also. And co-pays are, like, if I end up going to the emergency room, my co-pay is like $120.
Yeah, I think mine's around this. It's either between like 80 to 120.
Yeah, so I'm just like, all right, God forbid I accidentally chop off a finger or something, because I'm going to be waiting until tomorrow morning to go to my primary care physician and pay my $20 copay. I'm not going to no ER. Even more obscure than regular insurance is dental.
I don't think I have dental insurance. I haven't gone to the dentist because I don't know how my parents' dental coverage works. I don't know what the extent of the coverage is. And I don't know how I qualify under their coverage because, like, for health insurance, we have the family coverage and then we all have our individual cards. But it's like under one parent.
Yeah,
right?
The subscriber.
But
your subscriber's under your member. Yeah.
Yeah. But for dental, we only have like a very plain like piece of paper saying dental insurance.
Yeah.
And like I don't know what that entails. I don't know which places take it. Like I don't want to just go up and get a checkup or whatever, and then you're checking out and you're like, all right, so that's going to be $1,500.
Yeah. So luckily, my dental is actually pretty good that I get through my job. I have a $60 deductible, which is pretty lit. So when I got my wisdom teeth removed, it was the first time I had used the insurance, and I only paid like $65. And that's because $60 was my deductible. So really, I paid like $5 to have my wisdom tooth removed. I don't get the other two removed now, but irrelevant. But I didn't know how much I was going to end up paying, but I was in so much pain that I was like, at this point, I will give you my next paycheck if I have to, like, just get it out.
Yeah.
And when she was like, yeah, you're going to be paying $65, I was like, oh, okay.
Oh, that sounds good. Here you go.
Yeah, like that sounds perfect. But I did learn there's a cap on my dental insurance. So they will only pay up to a certain amount each year. And it's not a lot. It's like $500 or something like that. But like,
please, a root canal is like $1,000 something. Right?
Yeah. So like, I think it's either 500 or 1,500. But
that's still not a lot.
Just
of money.
getting a tooth removed is like $500 with no insurance. So
if you're lucky.
Yeah, because my mom had called the dentist because she cracked her tooth, and the emergency dentist was like, well, we're not taking any new patients because COVID is still a thing. And then she went to a private office, and they were like, yeah, so first we need to do a consultation. That'll be $300. Basic tooth extraction is another $400, but depending on where it is and what we find, it might be more. So like a minimum, she was looking at $700 to get a tooth removed.
Yeah.
And then even more obscure than that is your vision insurance.
Oh, haven't used that ever in my life.
I don't have vision insurance.
Hold on, but you...
Yes. I work in the optical world and I do not have a vision insurance. But it actually makes sense. I get one free eye exam through my job a year. So that's really all I use vision insurance for. Like I don't have like glaucoma or anything like that. Yeah. So it wouldn't make sense for me to pay extra for vision because I just need my one exam a year and for the doctor to write me my new prescription and I'll call it a day. But working in the optical world and seeing people's vision insurance made me realize how ridiculous it's set up. Because people come in and they're like, do you take my insurance? What insurance do you have?
Yeah.
I don't know. Vision insurance. Like, I have this conversation at least twice a day. And they get angry at me for not knowing what insurance they have.
That's amazing.
And I'm like, well, I need to know who your provider is in order to know if I take the insurance or not. And then they get angry and they're like, wait, I have my card. And I'm like,
okay, you should have led with that.
I also just wanted to know the name of your insurance. I don't need all the details because we only take one insurance. Then I'm like, well, the only insurance we take is XYZ. And they're like, okay, anyway. And then they proceed to take out their card, which is not the insurance I have just named.
Yeah,
and they're
obviously.
Like, so this is the insurance you take?
No.
I just told you no. And then I explained the process of reimbursement, which is another beast all on its own. Every insurance has different plans and every plan has different reimbursement. And so customers expect me to know how much they're going to be getting back.
Yeah.
After I've told them I do not work with this insurance, I do not know what your plan is. And I've called like insurance companies 3 times for customers because they refuse to call themselves. And they're like, well, I don't know what to say. And I'm like, me neither. Like,
this is
not my insurance.
Yeah, it's your insurance. What do you want me to do about your insurance? Oh my God.
And they're like, how do you not know my plan? Can't you just look me up? I don't work with this insurance. Why would I have access to their systems?
Oh my God.
But it's very frustrating. And then people come in upset and they're like, I applied for reimbursement and they didn't give me anything back. You told me that I would get reimbursed. And
you don't have an affiliation with the insurance companies. So how are you supposed to be responsible for... Anyways, you can tell that we love this topic so much. And it's definitely something that we're very passionate about and, thrive on.
Absolutely.
But it's like, I'm still under my parents' insurance for another year and a half. Not even, like a year and a third. And then I have to figure out what I'm doing. The thing is, like, I don't want to have to get a full-time job just to get insurance.
I mean, you don't.
Yeah, but then it's a real expensive cost out of pocket for an individual insurance plan.
It depends on how much you make. If you're doing your freelance job, you're not making a lot. You might actually qualify for Medicaid.
I make like $5 a week.
You might actually qualify for Medicaid.
Well, we'll see when that time comes.
But there's also a minimum for that.
Yeah.
So you might have to make a little more than that to qualify.
Anyway, please like and subscribe to our channel and comment and do all the things because we would like to not be tied to a job for our insurance.
Please.
It's a really rough time out here, and it doesn't get any easier. Like the way that they're all separate entities.
Yeah.
And dermatology is a whole other ballpark
I
in
don't
and of
even know
itself.
how to work that. Somebody was like, yeah, I'm going to my like yearly dermatology appointment. And I was like, what?
I recently got a dermatologist, and you know, I've gone through a lot of my life dealing with a lot of skin problems and like acne and stuff like that. And this is the best my face has ever looked. Like since you've known me, like I've always been very insecure. Like I used to wear makeup in college, and I completely stopped after I graduated.
I have not.
Yeah, like if you've watched the 5-day videos that I put up on the channel, check us out, Sherley and Sarana on YouTube. Not an ounce of makeup, and I'm pretty sure you can see because there's like at the end of the day, I have like just straight up death in my eyes. Right?
That's me with or without makeup, though, to be honest.
But one of my friends was like, "Oh my god, look at you! You're like glowing," and I'm like, "Oh my god, thank you! I washed my hair." But getting a dermatologist, like, it's still expensive because there's a copay every time I visit.
Yeah.
And then whatever they prescribe, they have like specialist pharmacies that do their distribution because like skincare and all those things take a different route, basically. So there's like specialty pharmaceutical companies that deal with that.
I went to the dermatologist because I had a rash on my leg and they prescribed me some like steroid medicine and I got it from Rite Aid.
Anyways, so I guess mine is just super bougie for no reason.
Yeah,
but
like he was just like, yeah, go to Rite Aid and pick it up. And I was like, all right, cool.
No, my medication was like $60-something.
Oh no, I paid like $10 for mine. And it was like this huge ass tub, which he was like, you only need to apply like a dime amount twice. And it's a huge tub. But he was like, you also have eczema, so you can just use it on that too.
Wow, we love a deal.
Yeah, I was just like, 2 for 1.
Yeah, no, but dental, vision, skin, and then regular health care for like your general physicals and whatever. What a mess. How are you supposed to navigate that? And you're not taught that in school. You're just like expected to kind of quote unquote grow up and
just figure it out.
Yeah.
And the thing is, like, they expect your parents to teach you. 1, not everyone has parents. 2, not everyone has present parents. 3, not everyone has legal parents. So, like, there are plenty of parents that are illegal that don't have insurance. So they obviously don't know how anything works.
Or just, like, have lived their whole lives in another country and don't know, like...
how the American healthcare system works.
Which no one really knows how the American healthcare system works, to be honest.
I had a coworker from England, and on our Uber ride, we would talk about like healthcare there versus here. And he was just like, yeah, I've lived here like 3 years and I still don't know how it works. I'm like, dude, I've lived here my whole life and I still don't know how it works.
But let's not say that, you know, universal healthcare doesn't also have its issues.
Oh, absolutely.
And like, you know, it's waiting times and stuff like that. But it's a way better safety net to know that you can go to the ER and not get billed like $5,000 for breathing the air of the ER, right?
Yeah, I mean, recently there was a video this woman had posted up of her bill. She got COVID and she got put on a ventilator.
Yeah.
And she came out and her bill was like $3 million or something like that.
Well, yeah, it's like higher demand and then that changes the pricing of your treatment. And it's so stupid because like if you're looking at really deadly diseases and illnesses, like say cancer, for example, right? I have a personal experience with like, you know, people close to me having to go through treatment and what like that. And not in America, but still seeing like just how many countries model their plans against the American like values and whatever. And it really sucks because it's really doing a disservice to the other nations that look up or had looked up to America before. And it doesn't make anything easier. Like you're dying and you want help.
It's also crazy that you have to shop around for doctors. Like just going back to dental, the dentist I go to, she's like a private practice, like it's her family practice kind of thing. And she only takes private insurance through people's jobs. And it's only her. It's her dental hygienist, and her receptionist. That's where I ended up paying the $65 to get my wisdom tooth removed. And like I pay like $30 per filling or something, depending on like what tooth it is.
Yeah.
But then I went to like this bougie dentist. I won't say the name because maybe they want to sponsor me in the future. But I went to this super bougie dentist and it's really nice. It's beautiful. Like, wow. Like it's amazing. But for a filling, they wanted to charge me like $130.
It's insane.
And I'm just like, I have to shop around to see what is going to benefit me the most. And that's kind of ridiculous. Like it should be a one-stop shop kind of thing. Like,
yeah, like with my like previous my ongoing health issues, I went to a multitude of specialists. And that's straight out of pocket cost.
Yeah.
Because each specialist under certain insurance plans, like they will charge you a certain level of your copay.
Yeah.
So there's like a maximum amount that each specialist can charge, and it's up to them to kind of, be like, okay, I'm going to max you on your copay, or no, my practice only takes like 15% of your copay or whatever like that. And it's so stupid because, like, in order to find the right doctor who can fully assess you and, give you a holistic diagnosis, you have to visit, most of the time, multiple doctors in order to get that, to be like, okay, this is a practice that I trust the most. Because, you can read, like, reviews and stuff online, but every health problem is very individualistic. So you're really on your own. There's no, like, guidance to be like, okay, there's this one umbrella and you can go to that, like, clinic or whatever, and they will help you and guide you to the right specialist.
Even they don't know what they do sometimes.
Oh, 100%.
I had some issues a while back where I needed to get, like, a sonogram of a certain part. That doctor specifically sent me to this place and they were like, make an appointment here. This is the closest to you. They take your insurance. Like, they do the kind of sonogram that you need. And I was like, all right, cool. And I went to make an appointment and she was like, we don't do that here. And I'm handing her the referral paper, which is another thing. Like, the fact that you need referrals for everything. Like, I can't just go to a specialist. I have to get a referral from my primary doctor to go to a specialist. And then she's like, oh, we don't do that here. And I'm handing her the referral paper. And she's like, well, I have to talk to my manager. Comes back an hour later and she's like, actually, we do that here. So I'm going to book you your appointment. Then I came back for the appointment. She charged me my copay and I was like, okay, cool, whatever. I paid my copay. And then 4 months later, I got a check in the mail for my copay that they were apparently not supposed to charge me.
Amazing. We love that. In conclusion, we have no idea what we're doing. The healthcare system also doesn't know what it's doing half the time. And it's such a complex process to really deter people away from, like, actually taking care of their health. Because when COVID hit, I was supposed to go in a lot earlier for the problems that I was having. Because I was suffering for like a good part of the year. And I only decided, say my problem started last year, like at the end of February. I didn't go to the doctor until the end of September.
Yeah.
Because one, I was really scared of, like, the high contact areas and the doctor's office. Like, in your head, that's just a manifestation ground for sick people, right?
And a lot of doctors just closed.
Yeah. So it was a hard time searching for a specialist during COVID.
Yeah.
But also, like, nothing else stopped. People still had health issues. It wasn't just like, oh, COVID is the only thing that we're dealing with.
Yeah.
No, like, everything was really impacted.
My sister cracked a tooth and got an infection and the dentists were closed. And she went to the ER. And she was like triple masked, crying in pain. And they sent her home with Tylenol. And they were like, there's nothing we can do because, like, the mouth is very, like, saliva, COVID. Like, we can't, the dentists don't work right now. And she was like, there's another man who was in the ER also crying of pain, like bleeding, swollen, everything. And they were like, give him some Tylenol and send him home.
And that's also, you're being sent home with like a $2,500 like bill, right? Yeah. Anyways, if you know the healthcare system better than we do and you can help us figure out this health insurance thing by the time we both turn 26, that'd be really helpful.
That'll be in like 19 days for me. Oh, countdown 19 days till I'm almost 30.
Oh my God.
Yeah.
I'm turning 25 this year. Anyways, last year doesn't count, so it is okay. Anyway, we hope you've enjoyed. Might have to go to the doctor. Oh my God. Hope you've enjoyed this episode. If you have any hot tips or if you have any people in places with universal healthcare that is willing to get married, let us know. But stay safe, stay hydrated, get vaccinated if you can, and see you later. Vaguely adult, things are just